You're listening to Conquering Retirement with Annuity FY. Real strategies, real stories, no sales pitch. Join Tom Hamlin and his expert guests so that you can make smarter moves faster. Hit that subscribe button and let's conquer retirement together. Welcome, everybody, to another episode of Conquering Retirement with Annuity FY. Guys, I'm really excited today because not only do I have Tom Hamlin of Somerset Wealth Strategies and an Annuity FY expert here, 35 years. If I keep saying that enough times, guess what, guys? It'll be 36. So just keep us on the show, and we can get there. I also have Brian Hamlin here, another Annuity FYI expert, but also today, extra special guest, we have Blake Franklin here. And Blake, I'd like you to kind of go and give us your bio, but you are our Medicare expert today because today's topic is Medicare, something that is really relevant because it's that time of year, or it's coming up, but it's kind of always that time of year if you're approaching retirement. So, Blake, how about take it away regarding what your experience is and the relevance of Medicare?
Mm-hmm. Sure. Okay. Well, thank you for the introduction, and I'm excited to be here. So, my experience with Medicare, I've, sold and been licensed in the Medicare space for about 7 years now. So I talk to a lot of seniors and have had experience with multiple scenarios. And obviously healthcare is a really important aspect of your finances long term, because, God forbid, things can come up, and as we get older, more expenses present themselves. So with Medicare, my role is to be proactive and just find the most cost-effective solution to help get you the coverage you need.
So a couple quick questions to start off with. Let's start off with just the bare bones of it, because for someone like me who is not near retirement, it's kind of a subject I haven't thought about. However, I'm sure much of our listeners, it's right around the corner. If not, they're already there. So who should be applying for this, or better said, give us the pre-retirement to when they should be applying, for instance.
Mm-hmm. So typically people apply when they turn 65. There are special scenarios where people can get access to Medicare Parts A and B prior to being 65. But it's either when you turn 65, or if you continue to work and you continue to stay on your work insurance, around the time when you're ready to retire, or if you decide that you want to just continue to work but step away from the work insurance, you'll have to enroll in Part B. And so when you get Part B, that's when you have 180 days to make a selection on your Medicare. So those are really the two pockets that most people fall into.
So what happens when you turn that age? Do you get notified by the government? Do you need to proactively reach out to someone? How does that process work or look like?
So most people are notified about Part A. If you've worked for 10 years or 40 quarters and paid taxes, in most cases, you'll have Part A already taken care of, and you'll automatically get that benefit. Part B is what you'll have to enroll in. And so Part B is when, you'll submit your application through the Social Security Administration website or go to the office. But Part A, typically when you turn 65, prior to that, you'll be notified of that whole thing. And maybe you'll maybe even receive a Medicare card with just Part A on it prior to you applying for Part B.
Real quick, Meg, I have a quick question.
Yeah,
First, I have a
absolutely.
little statement here. I just looked this up. 11,400 Americans are turning 65 every single day. And, one thing I think about is that, not everybody needs an annuity or an ETF or a stock or a mutual fund, but everyone that hits 65 in this country will be participating in Medicare. And so that's a lot of people, 11,400 per day. And I have one question, if I can here. What are the most common or some of the most common misconceptions about Medicare coverage that retirees should be aware of when planning their health care in retirement?
I would say one of the biggest misconceptions people have is that um, there's a one size fits all scenario. Um, there's going to be a lot of marketing material that people receive, whether it's mailers or maybe they see commercials or there's a friend or family member that recommends this approach or that approach. Um, I would recommend every single senior take time to speak to a specialist prior to making their decision. Um, because some choices that are made cannot be undone. And so it's important to have some guidance through that process.
I'm looking at a survey here. Just one more time, Meg.
Mhm.
Meg has some jackhammering going on outside of her condo there, and let this be a lesson to all. That's what happens when you don't make your mortgage payment. We'll get you covered. Don't worry. We got you. So they'll they'll so um question is, in this survey, it says that one of the common myths is a belief that Medicare covers all healthcare costs, including long-term care, which 60% of surveyed retirees falsely assume. Is there any truth in that?
There is truth in that. Um, there's actually some other things outside of that. So, um, outside of what Medicare will cover for, say, like a cancer diagnosis, for example, um, there could be some chemotherapy or some maybe more natural approaches that aren't covered by Medicare. We also help with cancer policies, which can help pay a lump sum for travel expenses, hotel stays, food. Maybe you have to pay for someone to watch your dog while you're away. There are some out-of-pocket expenses that can take place that not everyone thinks about. And so there are still some gaps with Medicare.
Thank you.
Yeah, one of the questions I wanted to follow up with was you said some choices cannot be undone. Can you give us an example of something like that?
Yes. So if someone sees a commercial and there's a Medicare Advantage plan, for example, that offers a grocery benefit, and so they want to enroll in that, but as while they have that plan, God forbid they're diagnosed with, a certain illness that could disqualify them from leaving that Medicare Advantage plan and switching to a supplemental or Medigap policy. There's in your initial enrollment, you can choose whichever option you want to go with. And so maybe you choose the Advantage side or you go the Medigap or supplemental. Um, but if the Advantage plan that you have proves to be less effective for the um, covering the illness that you have, and you decide you want to go down the Medicare route later on, you have to go through health questions and you have to qualify in order to be accepted for that coverage. And so, there has been instances I've dealt with where, some people want to make changes that they're not qualified to do so.
And so, Blake, we're talking about different types of plans, for different needs. I mean, can we maybe take a step back for the people who aren't as well versed in this and just talk about, I mean, let's just talk about parts A, B, C, and D. Maybe you could explain the difference between those and
Mhm.
how retirees can decide kind of which combination best suits their needs.
Mhm. Of course. So part A is, um, going to help cover your hospital needs. And so parts A and B are original Medicare. Parts B is what helps with doctors. So your primary care specialists and things of that nature. And so those two pieces you have to have in order to move forward when it comes to supplemental or advantage. Um, Even prescription drug coverage, you have to have at least part A.
Mhm.
And so it's recommended. that you again talk to a specialist prior to making a decision. But the Part D is drug. So, D for drug. And so that obviously assists with your prescriptions and, medications that you take on a daily basis. Part C is Advantage plans. And so the supplemental coverage is just Medigap or supplemental. It doesn't have a part name. But A, B, C, or D, those are all different aspects of your Medicare coverage. Part A and B again is required in order for you to have the additional. And so just to keep it simple, Part A and B cover 80% of the expenses, 99% of the time. And then whether you have a supplemental plan, that'll cover the remaining 20%. If you decide to get a Medicare Advantage plan, that will replace your Medicare Parts A and B. And so when it replaces your Parts A and B, then at that point, now you have co-pays or co-insurances that you'll have to pay out of pocket depending on the specific Advantage plan that you choose. So not everyone understands that Part A and B will be replaced when you get a Medicare Advantage plan. That's just important to understand that that's a difference.
So real quick, what's the difference between just between Advantage and Supplement? Because that clearly is a big deal.
So there's quite a few differences, but the Advantage plans, they're a one-stop shop. So they have prescription drug coverage included. There's dental, vision, and hearing included in most of the plans. Again, the prescription drug coverage is included in most of the plans. A lot of the plans also have assistance with specialists, primary care doctors, chiropractic visits, therapy, all different types of benefits. It's a one-stop shop. But again, there's co-pays, so it's more of a pay-as-you-go option versus a supplemental plan. You pay your monthly premium, and the majority, if not all, of your doctor and hospital expenses will be taken care of, but it does not come with dental, vision, and hearing coverage. It does not come with prescription drug coverage. Those are policies you'd have to purchase in addition to your supplemental. And then the supplemental plans also don't have networks, where Advantage plans, typically they're HMOs or PPOs. So you just have to ensure that your doctors are in network with those Advantage plans.
Got it. So it'd be fair to say if you want to make sure that your doctor is a part of your path going forward, Supplemental might be the path forward for you, just if you're unsure of that.
Right. That's what I'd recommend. But outside of that, there's premiums for the supplemental plans. A lot of the Advantage plans don't have premiums. It's a $0 premium. And so depending on your financial situation, some people choose the Advantage plan because of that. But just know that you pay on the back end instead of the front end then in that instance. So you're going to be paying the co-pays, co-insurances, the out-of-pocket expenses will fall on you versus a supplemental side. Maybe you're paying roughly $120, $150, $175 a month, but exactly, you can budget kind of what expenses will look like.
So I just looked something up. There one of the questions that have been asked before is what's the difference between the original Medicare and Medicare Advantage? So I guess the Parts A and B was the original, what you said, and then there's the Advantage.
Mm-hmm. Right. Yes. So another thing about the Advantage side is that these are private insurance policies, and so carriers can choose whether or not they're willing to cover certain things. If it's deemed, cosmetic or unnecessary, they can say no to coverage for that particular service. Where on the supplemental side, that's not going to happen.
So how would you know if you're someone that's taking a lot of medication or just an important medication? How do you know that or ensure that your medication will be covered under your specific plan?
Mm-hmm. So the prescription drug coverage has formularies, and so they list what prescriptions they will cover. Typically that's updated, from year to year. And so these prescriptions are listed on through tiers. So like a tier 1 prescription is a preferred generic medication. Tier 2 is standard generic, and then it continues to go on from there. So, the more cost effective is the preferred generic, and then, the copays continue on from there. And so initially, when you're having that conversation to find which plan you want to go with, if you were talking to me, for example, I would ask for a list of your prescriptions, and then we have a system where I can enter those in and, find the most cost-effective coverage that would include the prescriptions you're taking. And from year to year during the annual enrollment period, we can then shop again and make sure that you're in the most cost-effective plan or make an adjustment.
So you're saying basically once you're in a plan, something you said was important. You should continuously seek out advice if your situation changes, or even if your situation doesn't change. Correct?
Correct.
Got it.
Correct. Yes.
How often do you recommend people do that? Kind of reevaluate things, look at their situation, meet with a professional, just to make sure all their ducks are in a row.
I would say probably once a year, at least. The annual enrollment period, October 15th through December 7th, is when we can look at the Medicare Advantage plans for the upcoming year. We can also look at the prescription drug plans for the upcoming year. When it comes to your supplemental plan, if there's a premium increase, say your premium's going up $20 a month or $50 a month, we can shop that every single month. Like there's not a window of time when you are able to look at different options. So that's a big difference as well.
So what if you turn 65 in March and you're outside of that window? What happens then?
So it depends. If you currently have Part B and you didn't make a selection on your Medicare options, you would have to go through health questions, and we would have to kind of evaluate your situation health-wise and see what you would qualify for, what you're eligible for. If you're wanting to go the supplemental route, the advantage, if you're wanting to take the advantage route, then we would probably either have to look for what's called a special enrollment period, which just means that we would have to find an exception as to why we're enrolling you in a plan outside of that window, or we would have to wait until January 1st. That kind of window of time. But January 1st would be when your upcoming plan would start. One thing to also keep in mind is that there's what's called late enrollment penalties. And so if you've waited beyond 63 days for your prescription drug coverage to start, if there's been a 63-day gap, that's when a late enrollment penalty can start to accrue and grow over time, and that doesn't go away. So the goal is to prevent things like that from taking place as well.
I have a question. So if I'm 60, when should I start looking into the Medicare and brushing up on it? Age 64, and then when do you get to make a decision? Is that 64 and a half, 64 and 3/4? When do you get to elect?
So if you're doing things the traditional way and wanting to make a change when you turn 65, it's 3 months before you turn 65, the month of, and then 3 months after. So you have that 7-month window.
But you're not making a change. You're just enrolling, are you not?
Right. I'm saying making a change from employer coverage to getting onto Medicare.
Okay.
Yes.
And so you don't want to wait beyond 64 and 3/4 because it takes a little bit to get you enrolled. And if you want to hit the ground running at 65, you want to get a head start on it, correct? Just like most things?
Correct.
And so what is it Parts A and B that are covered under Medicare, and then everything else is considered supplemental or an advantage plan beyond that? Is that how it works?
So Part A is the part that you're going to get automatically as long as you've worked for 10 years or 40 quarters. And then Part B is what you'd have to apply for. Those are original Medicare. Part B, you do have a premium that you have to pay on a monthly basis for. And then, yes, outside of that, you're either getting an Advantage plan or a supplemental plan.
So when we send our clients to you to assist them in this process, what are they looking for? Are they looking for parts B, C, D? What are they looking for? Or an Advantage plan? What would you be telling them? If I was 64 and a half today, what kind of questions would you be asking me?
So I'd be asking you, okay, are you planning on retiring when you turn 65?
Yes.
Or are you wanting to? You are? Okay, great. So then I would be saying, have you
No, I'm really
applied
not,
for?
but for purposes
Right.
of this, don't
Absolutely.
worry,
Right.
anybody. I'm not going anywhere. I'm going to die right here.
There was 36 in the intro, but
I'm going to be
not
like
sure
this
about
on podcast number
after
2723.
Yeah.
And take it away, Mick. Oh, right there. Right.
So if the scenario is somebody's wanting to get their Medicare coverage right when they turn 65, they're 64 and a half, I would pull up our system. I would put in the prescriptions they're taking. I would put in their doctors. We would just do an overview of what their options are. I'd let them know what Part B, their premium would look like for that. I'd pull up the either supplement or Advantage plans, let them know what to expect for that. And so my role is literally just to provide a quote of all the coverage that they're currently getting and just kind of compare it to what's available through Medicare. So if they're getting, if they have a particular dental plan that they're paying, $30 or $40 a month for through their insurance, through their work insurance, then I'm going to find maybe a $30 or $40 option that's comparable to what they have. And so I'll send a follow-up email. Okay, your Part B premium is $185 a month. Your supplemental plan is going to be $120 a month. Your dental, vision, and hearing coverage is going to be $45 a month. So, if we total all that up, maybe the total's, I don't know, $400 total a month is what you're going to be expecting. And so once your Part B goes into effect, Part B is in boy, you've applied for that. Typically, there's a 30-day window from when you apply to when it is approved and goes into effect. So once you've applied and everything's going into effect, give me a call. We'll submit those applications for your supplement, your dental, vision, and hearing, your prescription drug plan, and then you'll be good to go on the first of the month that you're ready for it to start.
So, this is anything but one size fits all. It's not seamless. They don't make it extra easy. And your advice, of course, as a specialist would be, contact me and contact us so that I can assist you through this process, which is not uncomplicated. Is that a fair statement?
It's a very fair statement. I mean, that's the reason why I have a job, is because it's
and it's not one size fits all either. Because somebody who doesn't take any drugs, if I'm not on any drugs and I'm not on any prescription drugs, if I can maintain that till I'm 65, then would I not elect to pay for a supplemental Part D because D for drugs, I don't need it? Or
so there is a $0 premium prescription drug plan. So you could still get one and not have to pay a premium for it.
That's great. So on that note, what are the average premiums that people are paying at 65? And do they vary between gender, male and female?
They do. So men typically have a higher premium for the supplements, but on the prescription drug plan side, it doesn't matter, male or female, but it could range from $0 all the way up to maybe like $110 premium, maybe a little bit more. So there's a pretty big range there, but typically the more you pay for it, the lower your deductible will be. So for the plans that are, $75 and up, there's probably going to be a $0 deductible on those prescription drug plans. So it just kind of depends. Even the Advantage plans are very, very customized based on your zip code and where you live. And, your financial situation. So that's another thing. There's benefits based on the area that this person is living.
Yeah.
Living. And then there's also IRMAA, right?
That's what
I always
you
think of the hurricane.
you stole my thunder,
I
Irma.
did?
Mhm.
Well,
Yeah.
no pun intended, because Hurricane Irma,
Oh man.
2017,
Yeah,
not
and
good.
the reason I ask is because we talk about, 64, 64 and a half. That's a good time to start looking into these things. But I get this question all the time. Irma has a 2-year look back. So something like selling your house at 63, that could have a big impact on your Medicare premiums that you're paying. Is that
Do
is
you
that correct?
real quick? Do you guys want to explain what IRMA is for
Yeah.
those that don't know?
Blake, please.
Yes. It is. So it's your income related monthly adjustment amount. So it is based on a 2-year look back, your modified adjusted gross income 2 years prior. And so there's an additional amount that you have to pay on top of your premium, for Part B, and Part D is in drug. And so there's a whole table that we look through, but essentially if you file individually, or if you file jointly, or married but separate, there's different categories. And so depending on where your income falls, that determines whether you have an additional amount you have to pay, or if you don't.
So insurance for most people is quite expensive, especially as you approach retirement. If you were buying it individually, it can easily exceed $1,000 a month. Is that a fair statement?
And in most cases, like the supplemental plans, if you're getting
No, before, like,
oh
let's say before and after shot. So a lot of people look forward to turning, 65 from the
mhm,
standpoint perspective that they can enroll in Medicare. And if they were independent, let's just say that they were consultant, 1099,
oh
independent
okay,
contractor, they're paying their own
yes,
premiums, and those can be over
yes,
$1,000.
correct,
And if it's husband and wife, and let's say they're both real estate agents, they could be paying, up to $2,000 a month,
Yeah, if they got
and
kids
that
and where
could
they live. Oh my gosh.
yes, and
Yeah.
that could equal north of 50% easily of Social Security at full retirement,
mhm,
roughly 67 these days. Is that a fair statement?
that's fair.
So what does it drop to using this scenario? You've got a pair of realtors, husband and wife, living in Florida. And they're in good health. What are they looking forward to if they were paying up to $1,000 each per month on their
hmm
regular insurance, and now they're going to switch over to Medicare? So
hmm
what is that? What is their out of pocket going to look like if they're in good health?
hmm
And not so good
um
health go the other way.
right,
And do they
so
have separate plans? I'm sorry. So
yes,
so if he's in good,
yes,
he's not in good health. Like, and then
There's
mhm.
she's
clearly
in
a lot
great
of
health.
things we're taking into consideration here.
Yeah.
Right,
Right.
right. So yes, they would both have separate plans. If she's in good health and he's not, typically the biggest difference would be the prescription drug plan. Um, if you're just starting Medicare, you're in what's called the initial enrollment period. And so you can select whatever option you want to go with, and it's not going to be affected by your health. And so let's just say that in this scenario, they're both going to go down the supplemental route. They both want Plan G, for example. And maybe they both go with the same carrier. There's going to be what's called a household discount. And so the carriers want to incentivize both husband and wife to be on the same plan, same carrier. So they'll discount that. And then, if they're a couple that has dental needs, maybe they're wanting to, have a plan that covers implants and dentures and extractions and the more advanced things. So that could be, I don't know, maybe $65 a month for that.
Wow.
Um,
Hey,
so that that's one aspect. And then, okay, if they're wanting prescriptions, maybe she's on the $0 premium, prescription drug plan, and he's on one that's, I don't know, $80 to $100 a month. So I would say they would probably fall collectively in probably the 8 to 850 a month
Combined.
range together, combined with all of
And,
those.
and how about, what would her side of that premium be? Would she be like 300 and you'd be 550, or
That's what I would say. Yeah,
okay,
somewhere around
somewhere
there.
in there.
Mm-hmm.
All right.
Mm-hmm.
But the goal, but typically what I hear you saying is that it's Medicare is cheaper. I mean, that's out of pocket either way, right? As opposed to.
It's much more cost effective. Yes.
Mhm.
Mm-hmm.
Got it. Brian, we're going to say something.
Yeah,
Sorry.
I wanted to jump to something kind of more recent. We're filming this in September 2025. This year, the one big beautiful bill passed. A lot of, changes are being implemented in that bill. In our industry, a lot of people are, implementing new strategies around tax planning. But it's our understanding that that's kind of impacted the Medicare world too. So maybe you could just go into, the changes that the big beautiful bill has had on Medicare, and how people are kind of addressing those changes. Just talk a little bit about it. That would be awesome. I think a lot of people are
Sure.
curious about how that bill kind of affects them in the many aspects of their life.
Sure. So, from my standpoint as a Medicare insurance broker, I'm going to approach the situation the same. I'm going to, try to understand your financial situation, your health, and then find the most cost-effective solution. So from a personal responsibility, there's not a big difference from my end. But as far as seniors go, I have a few notes here. So if I'm looking to the side, this is what I'm bringing up here. So, there's going to be some changes if you're a non-US resident, or sorry, non-US citizen. Some could lose Medicare coverage. So that's going to be a pretty significant change. Um, some of the prescription medications, they in the past would negotiate on how much it would cost out of pocket, and a lot of the negotiations won't be taking place once the bill is implemented. There could potentially be less benefits available for low income seniors associated with the Medicare Savings Program or Medicaid. So those are changes that are also can impact a pretty significant amount of people. The good side is there's going to be a cap on particular prescriptions, including insulin, $35 cap.
That's great.
Vaccines will be covered by Part D. Rural community hospitals are getting additional funding to keep them open and provide availability and resources for those communities. There are some doctors that are getting a pay bump to increase, again, their availability as well, provide more resources for seniors. And that is the overall summary of a lot of the information that
The,
I've collected so far.
the pharmaceutical cap on prescription drugs is huge. I mean, I've been, as Meg said, 35 years in this business. And I mean, I've had clients over the years that would get together with a group of other seniors, and they would get on a bus and they'd go to Canada to get their drugs. So they'd go to Mexico and to save money. I mean, same drugs, completely different price profile. And, that has always irked me quite a bit. I mean, I just don't like being taken advantage of. I don't think anybody does. And,
Right.
if for that to be capped, like you said, insulin at $35, I would imagine they were charging in the hundreds of dollars for insulin to certain people. And it's just, it's very discriminatory. It's very gouging. And it's just nuts to me that you could produce it here in the United States and sell it to the Canadians or Mexico for a fraction of the price. But here, you were just completely getting taken advantage of. And it's Medicare that's getting taken advantage of because it's the pharmaceutical companies that are charging Medicare. And, you have Part D, it's getting covered for $85, but the big pharma is charging Medicare massive amounts. I don't understand how the government even tolerated that, and I'm grateful that it's being. It feels like it's getting fixed, and
Right.
I know that Mark Cuban has a company that does that.
Yes.
I know that there's another company
Cost
that
plus.
does it as
Mhm.
well. Yeah, and I mean, yeah,
Mhm.
cost plus, some small and nominal markup, and I think that's wonderful. It's been a long time coming because I've been talking about it my entire career, how just
Mhm.
frustrating that is, and the enormous amount of people don't understand that indirectly, if not directly, we're footing that bill. We're paying for Medicare and we're paying for Social Security for our retirees. And,
Mhm.
I'm the tail end of the baby boomers, born in 64. First ones were born in 46. And at some point, there were like 79 million of us. I don't know how many are left. And I did look up a stat because when you say that 11,400 people turn 65 every day. You also have to look at the flip side. Well, how many people die that are 65 plus every day? And I looked that up as well,
Mhm.
7,100. So there's a
Wow.
net delta of 4,300 people that are being added to Medicare because
Mhm.
7,100 just came off Medicare, and 11,400 just came on. So
Mhm.
anyway, I just I
Yeah.
if you go to usdebtclock.org, it shows just what the impact is of Medicare and Social Security. And I mean, the liability and the legacy cost on this are so enormous. And anything that we can do to keep those costs down for Medicare, because
Mhm.
it's not the typical citizen that's paying for it. Their costs are going to drop by 50 to 75% once they join it. So
Right.
that's my rant for the day. Um,
Well,
so
one other thing to take into consideration is that um, post COVID, there's been a significant amount of usage with these Medicare policies, which has increased premiums and just significantly increased costs. And so, um, people weren't going to the doctors or getting procedures or things done prior to or during COVID. And so now we're seeing that as usage increases, Medicare spending has increased and um, they're trying to combat that in ways by increasing premiums. Um, and so it's important to talk to a specialist, not because of the recommendations, but also because we often have some inside perspective on what's, which policies are going to increase in the future, where premiums could look like, 5, 10 years from now, what direction to go in so that you're proactively in a position where there's some stability in your income, stability in the costs out of pocket.
If someone, if someone calls you or reaches out to us, better said, after this call, will will they expect to? Uh, do you charge anything for your services? Better said.
No, I don't charge anything for my services.
Okay, so basically, they can expect a consultation, some free help, and hopefully, you can help improve their situation or start them off on a path that's right for them.
no
Correct.
commitment.
Yeah,
Okay,
exactly.
Correct.
that's
Yeah.
correct.
And I'll just say that and Blake said it and Meg said it. Nothing is one size fits all. It's very important to take the time to go and speak with a professional about these things. I mean, you want to make sure you're picking the right Medicare plan. You're only going to retire once, hopefully. You want to make sure that you do it right. You do it the right way. You go about it. You want to ask all the questions you can. There's probably going to be questions that you didn't think of. So, it never hurts to just talk to someone about these sorts of things. And that's why we use Blake. I mean, Tom, I mean, he's been in this industry for 35 years. Meg for 12, myself for far less. But, we use someone for Medicare because it's important that our clients are getting access to, people who really kind of specialize in that sort of area, in that niche. So even, the professionals are using other professionals and working with other people.
Right.
And that's to get the best, possible solutions for everyone that we have the pleasure of working with, speaking with, that sort of thing. So if we're doing it, it just shows, we really believe in this stuff. And, that's what I have to say
great,
about
Brian. I always say that, we're the specialist in certain areas, but oftentimes, we're the general practitioner, the GP, and we identify a specialist to help with that specific instance and situation and need. And, Blake and his team are our Medicare specialists. So anybody mentions Medicare, we introduce them to Blake. So for anybody out there listening, even if you're not a client of Annuity FYI in Somerset, by all means, just go ahead and contact us and we'll put you in touch with Blake and his team and make certain that you get your questions answered. And that's what we're here for, to help add value.
And Blake, that doesn't have to just be people who are 64, 64 and a half. It could be someone who's looking for that, kind of yearly check-in or to check in to make sure that their plan aligns with their goals. Is that correct?
That's correct.
Mm-hmm. Awesome.
Great. Well, do we have any parting words for Blake? I mean, you've been wonderful. Those are my parting words. I've learned a lot today, and this is
sure
not my
have.
first time with this. I think it takes a couple rounds to actually wrap your head around this, which is why it's important to check in every year. So, I appreciate your time. I know Tom and Brian appreciate your time.
Yeah, Blake, you're awesome.
Yeah, this has been a really fun chat today. So,
You're fabulous, my friend.
Thanks so much.
Thank you. Appreciate
Until
it.
next time.
Thank you for having me.
We'll talk soon, Blake. Thanks a lot.
Talk
Thanks
soon.
a lot.
Thank
Talk
you
later.
all.
Bye. That's a wrap on this episode of Conquering Retirement with Annuity FY. Ready to take control of your future? Call 1-866-223-2121 to speak with one of the guests on our show and get your questions answered today. Visit annuityfy.com for more information and to contact us online. Follow the show and make sure to turn on notifications so that you'll never miss a tip, strategy, or breakthrough moment.